Hi, Candace.
Hi, Candace.
Hi, Emily and Monica. How are you both?
Very good.
How are you?
Doing well, thanks. Thank you so much for joining me this morning. I appreciate it.
Our pleasure.
You're welcome.
Emily, how does the Leukemia and Lymphoma Society raise awareness for blood cancers through this awareness program?
We raise awareness many ways. I think the most important one is that we provide services to our patients on an ongoing basis. That's what we do every single day of our lives. The second way truly is to provide education to healthcare professionals, physicians, nurses, social workers. The third one is doing exactly what you and I are doing today. Through these interviews, it makes a lot of sense. You as a credible source and myself, we make sure that people understand what there is to know about leukemia and lymphoma. And at the same time, I would say the fourth one, if you haven't seen it already, we do have a public service campaign. It's called Someday is Today, and it speaks to the fact that the cure is closer for blood cancers today than it ever has been before. We have billboards, we have brochures, we have radio spots, TV spots, so all together is how we raise awareness for leukemia, lymphoma, and myeloma, as well as non-Hodgkin's disease.
And what are blood cancers and how do they differ from other cancers?
Well, blood cancers are those cancers that specifically affect the cells in your blood system as well as your lymphatic system. What makes them truly different is the fact that you can't prevent them, and there's no screening in place to really detect that you have a blood cancer. And just to put some statistics out there, every 4 minutes, a new person is diagnosed with a blood cancer, and every 10 minutes, somebody dies from a blood cancer. So keep in mind also that it's the third largest cancer in the United States. We follow lung cancer and gastrointestinal cancer, and then come the blood cancers. So it's a very concerning number, and just so you know, Hispanics in particular have a higher incidence of blood cancers than the rest of the population.
And as a Hispanic myself, why is the rate higher for Hispanics than others?
We don't know the root cause of that, but we do know when we look at statistics that certainly Hispanics and specifically children have a higher incidence also of leukemia. So this is why it's so important to raise awareness for it, so that people actually can understand if there's any anomaly going on in their body or the body of their child, that they be sure to speak to their physician.
And Monica, can you tell us about your diagnosis and treatment?
Certainly. I was diagnosed with acute myeloid leukemia in March of 2004, and I underwent chemotherapy treatment, which put me into remission, but I needed a transplant. It was so aggressive that it would come back within a year. I underwent a bone marrow transplant 4 months later.
And how has LLS helped you in your journey from diagnosis through treatment?
Well, about a month later after my diagnosis, a friend called and said to me, you need to contact the Leukemia and Lymphoma Society. They will guide you, they will help you. And that's exactly what I did. I contacted them. Being a Hispanic, I was not educated as to what the disease was. They did. They informed me and my family as to what the situation was. They gave me a lot of support. They were very caring and guided me through the sources, and they also supported me financially by reimbursing medical co-payments that I had incurred.
And did you face any unique challenges as a Latina in your journey?
I did. Actually, when I moved, I had to move to Seattle for 4 months to get my bone marrow transplant. And I was in a place where no one really spoke Spanish. I traveled there with my parents, who were to be my caregivers. And it was hard on them. They had to be in the center where I was treated. They had to be provided with an interpreter so that they would understand everything that I was going through. So it was very hard that I couldn't really care for them that way, because I was very sick.
And what would you say to someone recently diagnosed with blood cancer? Do you have any advice for them or their family?
Yes, I would ask them to contact the Leukemia and Lymphoma Society so they can get educated, so they don't go through what I went through. They will help them. I will tell them to be positive. You need to have a positive attitude. Cancer is not a death sentence, it's a challenge. And you can take this challenge and fight for your life. And I did. And you can do it also. I will tell the patient, you can do it. it can be done.
And how are you involved with LLS today?
Well, I'm a participant of a program that they have. It's called the First Connection Program. They match the patient who has a similar diagnosis to mine with me. And I either call them on the telephone and speak to them about my experience, which helps them a lot, because when you're going through that, you feel you're alone, that no one else has gone through this. Knowing that person has gone through it and survives it is so encouraging. And I always have a good response. If the person is here locally where I live, and if I'm able to visit them, I go to the hospital so they can see that you can be sick and feeling horrible at that time, but years down the road, you can look the same way I do, full of life.
And do either of you have any additional information you'd like to share with us?
Sure. Let's go ahead and let me give you, so that everybody knows what our website is. It's www.lls.org. In Spanish, it's www.lls.org/español. Also, our Information Resource Center, the number to call, and there's people who speak both English and Spanish, is 1-800-955-4572. And of course, we have a network of chapters throughout the United States. There's one in your backyard. You can just pick up the phone and call one of your local chapters if you have any type of questions or would like to make a donation so that we can find that cure sooner rather than later.
Well, thank you both so much. I appreciate you taking time out of your busy schedule to speak to me this morning. Best of luck to you.
Thank you.
Thank you. Bye-bye.
Bye.